It's 19 minutes away from 3 o'clock. Good afternoon. This is Richard. As I mentioned earlier, August is Hair Loss Awareness Month, raising the importance of discussing hair loss and the impact that it can have on people's lives. It's estimated that 85% of men will be affected by it at some point in their lives, and it affects around 2 in 5 women. But what impact does it have on some people's lives, and what can people do if they are affected? Well, one of Britain's leading hair loss surgeons, who happens to have a surgery based in Leeds, is Dr. Furqan Raja.
Hi, good afternoon. Thanks for having me.
Thank you for coming on. I have to declare, first of all, that you're talking to an entirely bald man here. But I might come back to that a little bit later on. Just talk to us about what's going on here. Well, what's the biggest causes of hair loss in the patients that you see?
Of course, yeah. I mean, by far the biggest presentation that we see is male pattern hair loss, which is very, very common indeed. And, is the cornerstone of my practice really. Is a vast majority of patients that come through the door are men at various stages of male pattern hair loss. Now, we're starting to see people coming in a lot earlier with early presentation, maybe in the early 20s. And, people are starting to come forward a lot more and look to have this treatment with hair transplant surgery, because I guess we're, as a society, moving towards a more image conscious society. And, things have certainly become busier for us in the past few years. And that's the way things are going now.
I was quite surprised that it affects 2 in 5 women.
Mm-hmm. Yeah. I mean, it's slightly different to what we see with men. With men, typically, it's a genetic predisposition to the hair loss. With females, there is a genetic component, but a lot of the time there's something underlying. Now, that could be something as simple as an iron deficiency, or perhaps a thyroid condition that can precipitate the hair loss and lead them down that path where they're losing more and more hair. So often it's a joint approach between someone like myself, a surgeon who can advise on the surgical treatment options, but also looking at the medical side of it and carrying out some investigations, blood tests, etc., to work out if there's something else going on.
Is hair loss something that can be reversed, something that can be slowed down?
It certainly depends on the cause. Now, a lot of our work is to do with long-term prevention. Particularly with men who are experiencing male pattern hair loss, usually that's down to a genetic susceptibility of the follicles to DHT, which is a type of testosterone. Now, depending on how sensitive those follicles are, they will ultimately start to shrink and fall out. And we use medication to try and counter that mechanism, so to block the effects of DHT on the follicles. And that works to really good effect. Sometimes can create a degree of reversal of the hair loss, but also a long-term prevention strategy that we use alongside a hair transplant to get you a longer lasting result.
How much has this technology developed over the last few years? Because I suppose it wasn't so long since, if you had concerns about your hair, perhaps a wig or a toupee was the only way you could go. But that's certainly changed, hasn't it?
Absolutely. I think the way the industry has developed massively, over the past maybe 5 to 10 years, and now it's really down to fine refinement of the procedure and making sure that we're able to produce a result which is largely undetectable. I deal with a lot of celebrity clients, and we're constantly working on ways to make it a more discreet procedure. So obviously people who are in the public eye, they don't want anybody to know that they've had it done a lot of the time. And I guess it's about 50-50 in terms of the general public. Some people are quite vocal about having the procedure, but others are very conscious about it. So I think it's developed and it's certainly become a lot more discreet as a procedure and the way it's done. The downtime is a lot less than what it used to be. And a lot of my patients the following day will carry on with their day-to-day activities largely, and they're able to mask it quite well. So most of the people around them don't know that they've had a hair transplant.
And I would imagine that there'll be a fair amount of people, and as I say, I haven't got any hair. For many years now, I've been buying Head and Shoulders just for my shoulders, but it's not something that bothers me. And I'm not saying that sort of as bully for me, because I do have, I'm listening to what you're saying, and I have sympathy for someone if losing their hair really does affect them. But am I in the minority, or is there a growing number of people who are happy to be bald?
No, I think there is a large amount of people who accept that look, and they embrace it, and they're completely happy with and confident with being bald. So the issue is more to do with confidence and self-esteem. Maybe if you've got somebody who's got a really good head of hair and they take pride in the way they style their hair, and all of a sudden they're starting to lose it. For a lot of these guys, it's devastating, and it feels like for them it's affecting every corner of their life. It can be personal, work related. They don't have the confidence that they used to. So a lot of this is about restoring that confidence and giving them perhaps a psychological benefit from the surgery as well. But certainly, what you said about people embracing the bald look. We used to get guys many years ago who'd maybe come in for a consultation and not be too fussed about having a hair transplant. And post COVID, when COVID hit and they were spending a lot of time at home, and perhaps they were on FaceTime and doing Zoom meetings, they started to notice their hair loss a lot more because they're looking at the camera all the time. And those people have started to come forward and embrace the idea of having a hair transplant. So it's interesting the way social media influences it, and being the way you look is being really important now, is influencing people's decision to have a hair transplant.
At the risk of asking the vulgar question, Furqan, but I am intrigued. I'm not asking for a quote here or down to the exact pounds, shillings and pence, but what kind of money are you talking about for someone to get a hair transplant?
Yeah, I mean, that's a really good question. And I think the important thing to bear in mind here is that there are a lot of clinics now that are opening up in the UK that are doing this, extraordinarily cheap. So, procedures that are maybe £2,000, £3,000. And for me, that's always a red flag. A good, reputable clinic, would not be able to provide this facility and that procedure at that cost. There's definitely some corners being cut there. And as a member of the British Association of Hair Restoration Surgeons, this is something that we're always actively campaigning against, because patients are not particularly well informed about black market hair transplants, which unfortunately do exist in the UK. A good surgeon can charge anywhere between £6,000 to £15,000 on average, depending on the type of procedure. So it all depends on what kind of procedure you're looking for, whether you want it as an unshaven procedure, which perhaps only a handful of skilled surgeons are able to do in the UK. And depending on your requirements, obviously, that affects the cost of the procedure.
Well, it's fascinating to talk to you. Thank you ever so much for spending some time with us. That's Dr. Furqan Raja on BBC Radio Leeds. Thank you. Thank you very much.
That's a pleasure. Thanks. Bye.
The sound of West Yorkshire.
BBC Radio Leeds.
Welcome once again to the Great Yorkshire Show.
We are